I'm Dr. Steinbruck, Douglas S. Steinbruck, and I'm at 620 Park Avenue. This is Aesthetic Surgery of New York, and we're at the corner of Park Avenue and 65th Street. Facelift does a variety of things. First of all, what we're trying to do is restore the natural anatomy of the face, but do it in a very natural way. And a facelift does three things primarily. It cleans up the neck, which is a main complaint of a lot of baby boomers. It also restores or sharpens up the jawline. And then the third thing, what it does is it gently lifts the midface and restores the soft tissue volume back up to the cheek. There's been a huge transition in terms of facelifting. It used to be in the 50s and 60s that it was a skin-only procedure where the doctors up and down Park Avenue used to grab that skin and pull it back, and resulted in a very pulled, a very windswept look, we call it. Whole transition now into the modern age has been to use underlying structures to really support the muscle and the retaining tissues that support that muscle. Not just pull the skin, but pull the underlying, what we call the SMAS, the tissue underneath, to resuspend it up in a more vertical direction to give you a gentle, more natural appearing lift without that pulled, that wind tunnel look. Facelift, there are a variety of approaches. I call the golden phase or the golden age from 45 to 55 where people start considering whether or not to have some kind of facelift procedure. If people are a little bit younger and they don't have as much sagginess or what we call facial ptosis, we usually recommend to have a short incision facelift or short scar facelift. Patients love this because for people who are more active, they like to play tennis, they like to wear their hair up, they like to go out a lot, they can feel free to do it without having a larger or a longer incision behind the ear. So for a younger patient population, that's ideal. Then we move into a slightly older patient population where we want to have more effect. They have a little bit more sun damage, a little bit more ptosis or falling sagginess of the tissues, and we want to do a slightly more aggressive but still very natural appearance and result. So for those people, we take a little bit more of the SMAS or the underlying structures and resuspend them. The other thing I may do for someone who is slightly older is I may be a little bit more intense in the area of the neck. Instead of just lifting from the side, I'll go directly into the neck to pull what we call those guitar strums, to pull those neck bands together to give a nice sharp contour to the neck. This is about the whole transition from minimally invasive procedures like Botox and fillers that start early on, and then once we get to the point where we've hit a wall with that, we need more. So that's when it's time to make the transition to going to a surgical procedure, either a mini facelift, a brow lift, or a full facelift. Now, does the Botox hurt? Does the filler hurt? Absolutely not. In fact, it helps. And what it does is it allows those tissues to stay a little bit plumper and have fewer lines because of the Botox and the fillers, so that once it is time to do a facelift or a brow lift, a mini facelift, or fix the neck, that it's a much more natural transition and the tissues are much more easy to work with because they have not been let go for such a long period of time.